So thank you for joining me again. I always love talking with you.
Of course, I love being here. And we're talking about a topic that is like my favorite thing to talk about. So I'm really keen to be here today.
That's so awesome. So I thought again, like it'd be really awesome if you could introduce yourself first,
Of
and just
course.
know who you are, what you do, and then get into the beautiful topic that we're going to talk about today.
That sounds great. Amazing. Thanks, guys. So, hi, everyone. I'm Dr. Talia Hashworth. I'm the director of Hashworth Psychology in Wollongong. Today, I'm here to talk about LGBTQ health and introducing the topic. It's a huge topic, so we'll just start the introduction of it today. Yeah, that's me. I'm really excited to be here today. I work predominantly with the LGBTQI plus community, borderline personality disorder, as we discussed last time, and trauma and neurodivergence as well too. So those are my kind of main areas of work that we do. And yeah, we run a group practice, and all of our clinicians are trauma informed, queer affirming, and neuro affirming as well too.
I love that.
So I'll just kind of start with the LGBTQI plus community stands for anyone who experiences some form of diversity in terms of the gender, the sexual attraction, the sexual identity, anything kind of in between there. So there's lots of letters in the LGBTQI acronym there. And the plus at the end represents that there's many, many more than we just refer to when we say LGBTQI plus. So there's a whole range of different kind of forms of diversity that we talk about. There's lots of different kind of terms that we use when we're discussing the community. So I can kind of highlight a few main ones that we talk about just to make sure that we're all on the same page. And if there's any questions, please do let me know. We talk about the word queer. So the word queer is kind of a general umbrella term that we use. So previously, the word queer had a lot of kind of negative connotation, but more recently, it's actually become quite a umbrella term and a really neutral term. So if someone says they're queer, that can mean anything of gender or sexual diversity or anything else in between there as well too. So a lot of the time we'll either call it LGBTQI plus health, or we'll call it queer health, or something along those lines there. But yeah, queer is a term that we use to identify as anyone who's diverse in any way, and those kind of aspects there. We refer to someone who is transgender as someone who was assigned a certain sex at birth and does not identify with that particular sex later in life, at any point in life. So we use that term transgender. And similarly, it's an umbrella term. So there's different variations of what transgender could mean to that particular individual. And I think one of the things I actually want to highlight before we get any further is that I'm just kind of talking from my experience as a clinical psychologist. I'm also a queer clinician myself, a queer psychologist myself. So I'm just kind of talking from my personal and professional experience. Every queer person has their own individual experience. So I want to be really clear that anything I say today may or may not actually apply to anyone who lives under the rainbow, as we call it. And yeah, I'm just kind of referring to my personal and professional experience there. So we've got the term queer, we've got the term transgender. In terms of sexuality, we've got so many different kinds of sexuality. Some of the ones that folks might have heard about are things like asexual, lesbian, gay, bisexual, pansexual. And again, there's lots of different variations of how that might actually look. Sexuality is not just about sexual attraction, it's also about romantic interests as well too. So it's important to be able to kind of separate those out. Sex and romance are two different things, and they can fall under different forms of interest for different individuals. And I guess the last term that I'll kind of highlight that's really important is a term that we call cisgender. What cisgender means is someone who was assigned a certain sex at birth and still continues to identify with that particular sex or gender. So that's someone who, for example, was assigned a female at birth and identifies as a female as well too. They would be considered cisgender.
Okay. It's also learning for me as we're going here, which is so amazing.
Yeah. There's lots of different terms. So those are just kind of a few, the main ones you might hear kind of in the media or just kind of any form there. But there's so many more. But those kind of just get us started with understanding some of the language that we'll talk about today.
Yeah. So when we look at health in general for this community, like what comes up in your work or in your world around health and around this community, and what's important?
Definitely, that's a really good question. So what we often see, not always, but often, are individuals that fall under the rainbow have experienced some form of discrimination, prejudice, trauma, judgment of some sort kind of throughout their life for whatever that reason might be. So a lot of the time, nowadays especially, we're moving away from people aren't seeking psychological treatment because they're queer. That's not actually why they're coming in. They're coming in because of other reasons, and their queerness is just one aspect of themselves. Previously, because being queer or being trans or being gay or any form of falling under the rainbow used to be so stigmatized, that often was one of the reasons why people would seek support and seek treatment. That's actually not the case anymore. So they're coming in for trauma, or they're coming in for neurodivergence, or they're coming in for something else, and support in that particular area, and they just happen to be queer as well too. So we've really moved away from people coming in because of their identity, as opposed to that's just who they are and they're stepping in the room with that identity, but they're actually coming in for a range of other presentations, a range of other reasons.
Yeah. Are there barriers for people in the community coming in and seeking mental health support?
Definitely simple things like just getting their correct name on a GP referral can actually be really, really difficult. One of the kind of constraints with Medicare is that the Medicare rebate can only be applicable if the legal name is actually on the referral, and if it's actually being put through as a Medicare rebate under the legal name, and not everyone identifies with their legal name. So some folks have chosen to change their legal name, but not everyone chooses to do that or is at the point in their life where they are ready to do that. So a simple thing like that could actually deter someone from getting support because their incorrect name is actually on the referral, and that's what they're going to be referred to legally and in the documents. And of course, you can change that as a practitioner and within the practice, but it's still going to be on the file, unfortunately.
Yeah. And if that's the first kind of point of call, then that's the first, yeah.
Exactly. Yeah. So it's kind of little things like that that don't feel so little for a lot of folks, can actually be a deterrence and a barrier to getting the support that they actually might need.
Yeah. So if they do manage to get the referral, then what happens then? Like, is there some other barriers that show up?
Yeah, definitely. So some of the things that could come up is family support. So families may or may not actually know or be supportive of the person's identity there. So if it's a child, for example, one of the things that we often experience is the child will hopefully feel comfortable letting their clinician know their appropriate name and appropriate pronouns, but their family members might not actually know. So when we're working with a child or a young person, it's quite difficult then to have family engagement and family support, because does that mean then when the parents in the room, we use the incorrect name just because it's safer and it's easier? Does that then unintentionally misgender them on our part as well too? So it's just about having those conversations. But it can be really tricky when we don't have family support, especially for young people who it's crucial to have their family involved in their therapy and their psychological journey as well.
Yeah, absolutely.
I think communication is just the most important thing, and just being on the same page and kind of having an alliance together of you are here, this is the person that you are, I respect the person that you are, and let's work together to get everyone in your circle around you to respect the person that you are.
Yeah. What I almost heard from you there is almost like a modeling for the people around them. And
Very much so.
yeah,
Yeah. Yeah, and it can be really difficult. And there can be a number of reasons why people choose not to out themselves or identify with that particular sexuality or gender in the home environment. There could be a lot of different reasons why people make that choice for them. And sometimes it can feel like it's not actually a choice. So it's just working with where people are in their journey. There's so many different stages of the journey, and it never ends, really. The reality is, any queer person has to out themselves almost actually every day. Every time they kind of meet a new person, they have to kind of out themselves, whether it's subtly or more directly. It's like an ongoing and everlasting, unfortunate experience, as opposed to someone who's cisgender or heterosexual can often go through the world and people just assume that they're cisgender and heterosexual. They don't actually have to have those conversations. But anyone who's queer often has to, every time they meet a new person, whether they're introducing themselves or their partner, or their pronouns, often have to out themselves, which can be actually very exhausting as a queer person.
Yeah, the word that was coming up in my head then when you were talking is like that, like the cost of having to almost explain themselves.
Completely over and over again. Yeah.
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 And I guess that's a big part of where we come in mental health, in creating that space where that, you don't have to explain yourself. And yeah.
That's exactly it. Yeah. And it's, there's so much progress that's happened in the world, like
Mm.
definitely so, but we've still got a long ways to go. And I would love for us to be at a point where we just use neutral pronouns and we just use neutral language naturally, as opposed to making assumptions. But at the end of the day, we are humans, our brains are made to fill in the pieces and make assumptions. No, people often aren't trying to do it intentionally.
Yeah.
But I would love for us to live in a world where people don't have to out themselves day in and day out, and they can just exist in a space where they are who they are.
Yeah. I know for me, like in the clinic, there's different like populations, different communities that come in, and they all sometimes they present like with different areas of concern. So, like, is there
Mm,
areas of concern that you see for this particular community when they're coming in to your clinic, when you're talking with people?
yeah, definitely. So, in terms of what kind of different populations we see,
Yeah, and what maybe some of the problems are that you see, that is there any common denominator of what's happening for this community?
definitely. Yeah, so trauma is a huge common denominator in terms of why people would present. Particularly at our clinic, we see predominantly trauma-related presentations anyway.
Mhm.
So trauma is a big reason why they would present. And not every queer person has experienced trauma, but the research does indicate that there's actually quite a few. And the rates of depression and anxiety are significantly higher for the queer population.
Yeah.
The reasons for that are things that we would expect, like prejudice and bullying, and just feeling like you don't fit in kind of throughout your life. So all of that would kind of lead to what we call either big T traumas or small T traumas throughout life. So that's often a big reason that people come in. There's also some research to indicate that the queer community has a higher prevalence of neurodivergence, of either ADHD or autism presentations as well too. We don't actually know why that could be the case, but a theory that is being spoken about at the moment is that neurodivergent people see the world in kind of more colors. They kind of have more of a broad view of the world and who they kind of are as people. This is just a theory, of course, but the theory then says that one can potentially have that better understanding of themselves if they're neurodivergent, because they know that there's kind of more colors to see in the world. So they can engage in different forms of relationships, like poly relationships or ethical non-monogamy relationships in different ways. And we often see that in a lot of the queer community as well too. So that theory could potentially apply there, that there's just a larger breadth of possibilities for the neurodivergent community.
Mm. The process of having to kind of explain like yourself and what's happening when you see different therapists or GPs or the psychiatrist, or like that experience is quite like impactful for people, right?
Definitely. Yeah, definitely. And I think especially if any clinician is using that kind of previous understanding that they're there because they're trans, or they're there because they're queer, or they're there because they're gay, when the person might not actually be there. So there can be a lot of kind of misunderstanding as well too, of actually that's just one part of who I am. I'm here to talk about my family. I'm here to talk about any other kind of challenge I'm experiencing in this moment. So that can be quite exhausting and quite difficult as well to just feel like misunderstood and just feel not heard and feel like they're kind of pigeonholed into this one little category because of who they are, when that's just a part of who they are, as opposed to why they're actually seeking that support in that moment.
If you're someone who is not part of the queer community like myself, what are some things that would actually be really useful for myself as the clinician hat, or even just as like the friend, the family member? Like, what are the things that are important for us to maybe know that can support, the people that we love and care about?
Yeah, I think that's such a fantastic question. I'm so glad you asked that. There's so many little things we can do just to support the community, just to show that we kind of care and we actually we want to understand. And as a as a cisgender person yourself, Sky, you don't have to know all the terms. You don't have to understand that kind of felt experience to be able to support a person who's going through any form of transition in their life. So the things that we can do are use inclusive language. So when you're seeing an individual for initial session and you're asking about their experiences and their family, instead of assuming that they have a boyfriend or a girlfriend, for example, we can just ask, do you have a partner? Or what's your partner like? We can just use neutral language like that and let them kind of decide if they're ready to say their partner's name or their partner's pronouns, because they might not in that first session, and that's okay.
Yeah.
So we can just kind of start changing the language we use. And when we're kind of talking to a bigger group, rather than saying ladies and gentlemen, we can just say folks, so we can say, hey, everyone. It's just the simple kind of changes that we use in our language that can indicate that we're here in a neutral space. We're not here to kind of pinpoint anyone or move into areas that people might not be comfortable with in that first meeting just yet. So I think changing the language we use when just getting to know someone, like if you know they have a child, rather than asking about their son or their daughter, asking about their child or their young person, again, using that neutral language, unless and when they indicate that they prefer to use the word son or daughter or whatever they choose to use, then you of course can go with that. But before you have the information, it's important to just have that neutral language as well.
I really want to hear what you just had to say, because that actually just shifted gears in my head. So
Yeah.
can you just reframe that acceptance and appreciation? Because I hadn't heard that before, and it's really interesting.
Yeah, of course. So the idea of acceptance kind of has this implication that we just have to kind of tolerate things. We just have to be okay with things because they are the way they are. Whereas more recently, we're trying to move into the idea of appreciation, where we're going to celebrate this person's existence, whether they're cisgender, whether they're trans, whether they're queer, whether they're a human being, whoever they are, whoever they show up as in the world day in and day out, they should actually be appreciated and celebrated for their existence there, as opposed to just kind of tolerated because they're different or there's some diversity there. And that applies to neurodiversity, that applies to mental health presentations, that applies to gender and sexuality as well too. That it's actually more, we're trying to move towards being more about appreciation as opposed to tolerance and acceptance.
I love that.
I think, yeah, there's definitely, like, even in terms of autistic folk, there's been more of a switch in between from kind of acceptance to appreciation, of appreciating just that autistic people exist and their brains are different and beautiful and wonderful. And we should actually celebrate their brains as they are. We don't need to just accept that their brains are different than a neurotypical brain. We should actually appreciate and celebrate because their brains are fantastic in their own ways.
Yeah, now you gotta love that. That's awesome. I'm gonna, again, it's the language, right? Like, this is the thing that I think is so powerful, because I don't think we always appreciate the meaning that comes behind the language. Like, just that then when I was like acceptance and you were like, well, this is how I see this and this is the meaning behind it, I was like, oh my God, of course. Like,
yeah, and definitely, I mean, like, it's just all of these things are kind of just ever changing, and there's so much kind of growth and development and new research coming out and just different perspectives. And honestly, like, it comes back to the base of, as long as you're trying to just support people, the language is important, yes, but just the intention behind it is the most important thing.
Yeah. Is there anything else kind of floating around in your mind that you actually think is really important to share today around health in this community?
Yeah, one of the other things I thought was important was around some of the things, I guess, you asked before, of what can you do to help support the community. It's really easy for us to overcompensate or over ask questions because we're really trying to show that we're an advocate and we're supporting the community. And sometimes they can actually have the opposite effect. And again, coming back to the intention is the most important thing. If the intention is to support, then that's all that really matters. But things like for a transgender person, for example, it's easy for clinicians or mental health professionals in general to kind of be like, oh, what was the name you used before this name? Though the intention is really great to understand the person, it can be actually very disrespectful to ask a question like that, because if they wanted to tell you their name, then they probably would. Yeah. What we refer to, the term that we use actually there is what we call dead name. So if someone is no longer using their birth name and has changed their name, we refer to their birth name as a dead name. So that, and it exactly is what it sounds. It's a name that no longer actually applies to them, and they have no actual relationship or connection to that name. So something that we can do as clinicians, be like, oh, what was your name before? What did you use before? When it actually has no relevance. There's no reason for us to know that. There's no reason for us to ever kind of explore that until and if that person ever wants to kind of share that with us. And if they do, great. If they don't, great too.
Yeah.
So I think that's important to kind of remember that, yeah, it's easy to overcompensate and ask lots of questions because we're trying to show that we really, really care and really want to get to know them. But it's important to kind of recognize that they want to share the information that they want to share and they want to show up as who they want to show up. They don't actually, a lot of the folks don't actually want any kind of tie to their the previous name or their birth name. And if they did, then they would have mentioned that to you. Yeah. And if they haven't, then that's probably for a reason.
Yeah, and that's okay.
Yeah. And there's other kind of questions like, oh, have you had surgery? Or what are your medical plans to transition? Things like that. Again, really, really good intentions, of course, but it's just important to remember that not every trans person, not every queer person needs to actually have surgery to affirm their gender. And what we say when we say affirm their gender is be able to be and show up in the world as the gender that they are and the gender that they are wanting to show up as. So we use the word affirm rather than previous words like transition or change genders or anything like that, because it's not about changing genders. It's actually just about affirming who they actually are at their core.
Yeah, got it. Yeah.
And again, so much language, there's so much to learn, but the intention is just so important. And usually, if there's a queer person in front of you and you use the wrong term, they'll just let you know and they'll just correct you that that's actually the way they prefer to be referred to, and that's completely okay. Queer people all throughout the world understand that not everyone's going to be an expert in this area, and that's literally okay. It's just about trying to respect that this is an individual and a human being in front of you, and they just want to be heard and understood. And that's as simple as it is.
Yeah. In terms of when we think about health specifically or mental health, are there things that like a practice can do to support people being able to, feel more comfortable coming to the service?
Definitely. Yeah. So there's things like just having a queer flag, for example. More recently, we're using something called the progressive pride flag. And the progressive pride flag has both sexual and gender identities on the flag. So there's different kind of colors for everything, as opposed to the previous flag we used to use, which was just the rainbow colors. And that was signifying sexual diversity, which is still great. But the progressive pride flag includes the different colors, pink and blue, to identify with the trans community as well, because they were actually never in that original flag there. So that's a flag that we use nowadays. And it just has all different forms of diversity in terms of sexual and gender. Of course, there's a bisexual flag and there's a lesbian flag, and there's all the different kinds of flags that have different colors and different meanings for the different forms of identity. But that's one that we're using nowadays, where it's a progressive pride flag. So you could put some flags around, or just put some kind of rainbow related stuff around any of those kind of indicators that this is a safe space. This is a space where everyone is included regardless of who they are, can actually make a really big difference of just choosing a practice that you can feel safe at, choosing practice that is going to make the effort to try and just get to know you as who you are.
Yeah. I think the word that you use there is really important, and not just for this community, but all communities, is safety, right? Like actually feeling safe to access the health support that you need.
Completely. Yeah, completely. And there's a difference between being LGBTQ friendly and LGBTQ affirming, where being friendly is, again, that kind of tolerating, that acceptance idea, where it's LGBTQ plus affirming is, I really want to celebrate your existence here, and I really want to make you feel seen and feel safe and feel wanted in this space. It's that extra step that we take to show that you are really important. You being different, you being diverse is actually so important to me and so important to this practice that we're going to really take the extra step to show you that.
Yeah. When you were talking the second time, I felt that in like my heart, right? Like yeah. It just lands differently, right?
It does. Yeah. And it's easy to kind of throw a flag around and say, yeah, we're LGBTQ friendly. And that's still great, but it's taking that extra step of, again, celebrating that diversity of whatever form that looks like for that individual.
Yeah. Anything else in that beautiful brain of yours that before we finish up?
Um,
Time so much.
yeah, of course. One of the things I think is important to talk about more in terms of the mental health space is something called W path assessments. Have you ever heard of that?
No, can you say that slowly for me?
W path assessments. So WPATH, it's an acronym.
Okay. No, I haven't.
Yeah, so it's a really important thing, I think, for mental health professionals to, and health professionals in general to be aware of. What a W path assessment is it's for someone who is looking, again, to affirm their gender. So that could look like any form of, in this particular case, it's looking like any form of medical affirmation. So that can be, there's a whole range of different things. So for younger folks, we're looking at things like puberty blockers, which are reversible. One of the big myths is if a young person goes on puberty blockers, they can't change their mind, or they can't make any changes as they grow up, whereas puberty blockers are completely reversible. So they actually can. You can be on puberty blockers from a very young age as well, too. So yeah, that's one way. There's then HRT, hormone replacement therapy, which are things like testosterone and estrogen. And there's all different forms of ways to medically affirm. So WPATH assessments are used particularly when folks are choosing to medically affirm their gender. It's not actually about socially affirming, which those ideas are about changing the way that you show up in the world to align more with your correct gender, changing your name, changing your pronouns, things like that. That's what we call socially affirming, whereas this is more about medically affirming. So when an individual is choosing to, if they choose to medically affirm, they often are asked to complete a WPATH assessment with a psychologist. And what that basically means is they have to do a few sessions with a psychologist who is trained in doing a WPATH assessment to basically determine that they have capacity to consent for the next steps of whatever that kind of procedure, whatever that medical intervention is. So they have to do, when I do it, I usually do 2 or 3 sessions, just getting to know someone. They could be an existing client of mine, or they could be a new client just coming in solely for an assessment. But I usually 2 or 3 sessions is sufficient. And I'm just assessing things like physical health, mental health. A colleague actually recently mentioned something that really stood out to me, that it's not about that your mental health has to be perfect to medically affirm your gender. It's just that if there are factors that are going to get in the way with your recovery, that's something we want to look at. And she gave the example of depression, that you can have depression and still medically affirm your gender. But if you are having difficulties getting out of bed, or if you're staying most of the day in the bed, will that then negatively impact your recovery? If you get, for example, top surgery or any surgical procedure, will actually staying in bed have a negative impact on the healing and the recovery of those wounds? So it's just having those kind of discussions. It's not to say that if you're depressed, you can't medically affirm. It's to say, that's okay, let's work together. Then what are the steps we can take to make sure that you heal and you recover well? So it's looking at those things. It's looking at making sure that they understand risk factors, if there are risk factors. And every surgery has some form of risk factor. So just having those conversations. One of the things that is really, really tricky about these assessments is psychologists end up falling into a bit of a gatekeeping role. And that's not something that we particularly enjoy doing. We enjoy being able to support the community and being able to medically affirm their gender, but it doesn't feel fantastic to meet someone for a couple of hours of their life and then say, no, actually, you can't go ahead and be the person that you want to be in a medical way. So it's a really difficult kind of place to be. And that's just where we're up to with what is a requirement for medically transitioning and medical affirmation of gender. So it's, one of the things that we're working towards making some changes with, that we shouldn't actually have that power to say yes or no, because the individual knows themselves well enough. If they've gotten to that point where they've made that choice and that's the right choice for them, then they probably know more than we do as a mental health professional who has just met them for the first time as well.
Yeah, that's so valid.
Yeah, so it's a really important space that we're working in the community of finding better ways to do that. It's all about making sure that they have the information, but it should be, or we hope it will one day be, less about kind of gatekeeping and saying yes or no, and more about let's just use this as kind of information. And this is a step that you're going to take, and you're going to take it regardless of what I say,
Yeah.
or regardless of what anyone should say, but let's just work together to get the information.
Yeah. And I like that sentence of let's work together as opposed to be the gatekeeper.
Yes, completely. And it's, like I do a lot of these assessments. I'll often have clients say, I'm just so worried that I won't be believed. And like, it's heartbreaking because I shouldn't, or nobody should kind of have that ability to even make someone question something like that. It's a really difficult space to be in. And more recently, a lot of surgeons and a lot of medical professionals are saying, you know what, we don't need to do that anymore. This person obviously knows what's best for them, and that's enough. But there are definitely still some surgeons who require that, or some medical professionals who require that. And it's one of those things that hopefully there'll be some progress with over the years to come. But the fact that we're already here is definitely progress to where we were even 3 or 5 years ago.
Yeah. So can you share again just a little bit about like your clinic and who you work with, so people are aware of like how they can reach out to you basically?
Yeah, definitely. Of course. So I mentioned at the start too. So I'm the director of a practice called Hashworth Psychology in Wollongong. We're just right in the CBD of Wollongong, and we have a range of different clinicians, including counselors, provisional psychs, registered psychs, clinical psychs, psychotherapists, and a social worker who's starting with us as well soon too. So we're a multidisciplinary practice, and all of our clinicians are LGBTQ plus affirming. All of us feel that it's important to celebrate that diversity in whatever way we can. We also work with more of the complex cases of higher needs trauma, DID, for example, any form of personality disorders, or anything kind of in between that would be kind of considered more moderate to high needs or high presentations. We also work with things like neurodivergence and all the different beautiful presentations that come with that. We do both therapy and assessments, ADHD, autism assessments, cognitive assessments, and everything else there as well. And of course, we work with the queer community, the LGBTQI plus community, of any form of sexual or gender diversity are all welcome within the space. And we do things like doubly path assessments, which I just mentioned. We do things like therapy. We're hopefully moving towards doing more group related programs that can support the community and can provide a safe space again for the community as well. That's something that we're hoping to get off the ground in the near future as well too. And that's us.
Can people access, like I'm just thinking, if people are listening or they're watching and they're not local to you, can they access you through telehealth or online?
Great question. Yeah, so all of our clinicians offer both face-to-face and online sessions throughout Australia. Some of our clinicians also offer sessions internationally as well too. So we do have the options that Wollongong's a small place, and we recognize that, and you don't have to be local to be able to get support.
Amazing. So just one last thing, I promise. So
okay.
what would be your takeaway for everyone listening from today's conversation? What is it that you would love for people to just hear?
That's such a good question. I would love for individuals to take a few moments today or over the week to just reflect on the steps that you can take as a person to allow people to feel safer around you. And that could be things like working on, and it is a change, it is definitely something that takes time and practice, but working on more inclusive language, or working on naturally just noticing when you make an assumption in your mind and noticing that it might be worth reevaluating that. It could be worth showing up and asking the queer people around you how they're doing, if there's anything that they need from you to feel more supported and to feel more included and accepted and appreciated. Any of those steps that we can take, of it only takes a few minutes to just reflect on what can I do to make the people around me feel safer. And it makes a world of a difference for anyone, whether they're cisgender, whether they're queer, whether they're anything in between as well too, just to feel like someone actually cares and someone's taking the time and the effort to allow me to feel safer.
Beautiful. Thank you. Thank you so much for your time. I really appreciate talking with you today.
Yeah, thank you so much for having me. And I hope there's a lot of information I kind of threw out there. So I hope some of it kind of stuck. And just, I think the biggest thing is, yeah, intentions are important and the language is very, very important, but it takes practice and it takes understanding. And it's okay if the language isn't perfect as long as we're just trying.
Yeah, beautiful. And thank you everyone else for joining us too.
Amazing. Thank you everyone for coming on today.
All right. Bye, everyone.
Bye.